When enrolled in Medicare, you are responsible for a bunch of out-of-pocket costs related to your healthcare services. For many years, people on Medicare had only Medigap plans to choose from for additional coverage. And while these plans have excellent coverage, not everyone could afford them. So Medicare Advantage plans were created to give people another option. In 2021, more than 26 million Medicare beneficiaries were enrolled in a Medicare Advantage plan. So it's fair to say that these plans are gaining in popularity. But what exactly is a Medicare Advantage plan? How do they work? And when can you enroll in a plan? I'm Danielle Roberts with Boomer Benefits, where we have helped thousands of clients find the right Medicare Advantage plan for them. And in this video, I'll be answering these and other important Medicare Advantage questions. A Medicare Advantage plan, also known as Medicare Part C, is a private health insurance plan approved by Medicare. By joining one of these plans, you direct Medicare to pay the Advantage plan to provide your medical care. In return, the Advantage plan will deliver all of your Part A and Part B healthcare services. They essentially take on your medical risk. You must be enrolled in both Medicare Parts A and B and live in the plan's service area to be eligible. And you must also continue to pay your Medicare Part B premium while enrolled in an Advantage plan. A popular feature of Advantage plans is that they often include a built-in Medicare Part D drug plan, which saves you from having to purchase that separately. Advantage plans were built with an out-of-pocket maximum cap as well on your medical spending, and you can think of this as a safety net. If you have heavy health spending that results in you hitting that out-of-pocket limit that is set annually by the plan, then the plan kicks in and pays the rest for the remainder of the calendar year. Now, Part D expenses are calculated separately, and your copays and drug spending are in addition to whatever you spend on inpatient and outpatient care in any calendar year. Also, it's important for me to say that Medicare Advantage policies are not Medigap plans. They work very differently because they pay instead of Medicare, not after Medicare. You can enroll in a Medicare Advantage plan during your initial enrollment period for Medicare or during designated election periods each year, which we'll discuss more in a moment. Medicare Advantage plans typically have lower premiums than Medigap plans, but in some cases you may find that you spend more out of pocket throughout the year for your healthcare services. This is because you will pay cost-sharing amounts to providers as you seek various healthcare services. Advantage plans can also offer additional perks and benefits, such as a dental, vision, and hearing benefit, or they may even include a free gym membership or an over-the-counter benefit for things like vitamins and supplements. Medicare Advantage plans are not required to include these extra benefits in their plans, but of course they often do so to attract Medicare beneficiaries like you to enroll in their plans so that the insurance company can get paid by Medicare for taking on your medical risk. Medicare Advantage plans usually operate an HMO or PPO network of providers. HMO plans are popular because of the lower premiums that they often offer. In some plans, an HMO premium may be as low as zero, meaning you pay no premium for the plan other than the Part B premium that you already pay to Medicare. When you're enrolled in an HMO plan, you usually must receive treatment with in-network providers, except in the case of a medical emergency. Your Medicare Advantage provider contracts with certain doctors and hospitals in your local area to form a network. And you will need to select a primary care physician from that network who will coordinate your care. If your primary care physician is unable to treat a certain health condition, he or she will issue a referral for you to see a specialist in the network. HMO networks are typically more restrictive than PPO networks, which we'll cover next. PPO Advantage plans have more flexibility than HMO plans. In a Medicare PPO, you can go outside of the plan's network for your services if the physician is willing to bill your plan. You generally pay lower co-payments if you see providers that are in the network, of course. You are not usually required to choose a primary care physician or get referrals to see specialists with a PPO. Each plan has its own rules though, so always check the plan's summary of benefits or evidence of coverage before enrolling. Many people new to Medicare ask us for the pros and cons of Medicare Advantage versus traditional Medicare with a Medigap plan, and much of this is in the way that you will access your benefits. With original Medicare, you have deductibles and you pay a 20% coinsurance on your Part B healthcare. You can visit any doctor or hospital that participates in Medicare, and most do. With an Advantage plan, you will use the plan's network of providers, which is usually local. You will pay co-payments when you receive the various healthcare services. For example, you might pay a small copay for a primary care doctor visit, but perhaps a higher copay to see a specialist. Likewise, some plans will charge you a daily hospital copay, and others might charge a flat amount for the whole stay. These co-payments can be sometimes pricey. On some things, you could even pay a coinsurance of up to 20%. We see this commonly with cancer treatment, where the plan expects you to pay 20% of chemotherapy or radiation charges up to the plan's maximum out-of-pocket limit. And this is one of the reasons it's so important that people who enroll in a Medicare Advantage plan also enroll in an inexpensive cancer plan to pay them a lump sum benefit in the event of a cancer diagnosis. Again, each plan sets its own cost-sharing amounts, so you'll want to review those before enrolling to make sure that you can afford them. One of the other biggest differences between traditional Medicare and a Medicare Advantage plan is that a Medicare Advantage plan is subject to change every year. Medicare may have small changes to the Part A and B deductible, but the 20% coinsurance that you pay on outpatient services is constant. Medicare Advantage plans can change your benefits and copays every year. For example, you could join a Medicare Advantage plan this year that offers a great dental and vision benefit. Now it's September and you get your annual notice of change letter in the mail from your Advantage plan, and you read that you are no longer going to have a dental and vision benefit next year. Now, you might be pretty upset, especially if you have an upcoming procedure the next year, and then you may want to consider changing plans during the upcoming fall annual election period. So remember, Medicare has shared this about Medicare Advantage plans. Limitations, co-payments, and restrictions may apply, and each plan's benefits, formulary, pharmacy network, provider network, premium, and co-payments may change on January 1st of each year. You will need to be diligent about reviewing the plan materials sent to you in September to see what's changing in the next year. But have no fear, you can change Advantage plans during certain election periods. Unlike traditional Medicare and Medigap plans, Advantage plans have lock-in periods. When you enroll in a Medicare Advantage plan, you will have two main enrollment periods where you can change or disenroll from your current plan if you don't qualify for a special election period. One is the fall annual election period, also known as the AEP, which is our busiest time of year. The AEP starts on October 15th and it ends on December 7th. During the AEP, you can leave your current plan and enroll in a new Advantage plan to begin on January 1st. Or you can drop your Advantage plan entirely and return to traditional Medicare and pick up a standalone Part D drug plan to go alongside it. And the second enrollment period during which Advantage plan members can make a one-time change is the Medicare Advantage open enrollment period. This enrollment period runs from January 1st to March 31st every year. And during this time, you can switch from one Medicare Advantage plan to another Advantage plan, or you can disenroll to go to Medicare and a Part D drug plan. What makes this enrollment period different than the AEP is that it's not a time to enroll in a Medicare Advantage plan if you have original Medicare right now. This election period can only be used by those who already have a Medicare Advantage plan. Medicare Advantage plans have different networks, premiums, and cost sharing. And in many urban areas, you may have 20 or 30 plans to choose from. Working with an insurance agency that specializes in these plans is a great way to ensure that you consider all of the variables before choosing your insurance plan and company. Our team here at Boomer Benefits is very familiar with how Advantage plans work, so give us a call. Our service is free. And don't forget to hit that subscribe button to stay up to date on everything Medicare. If you want to hear more about Medicare Advantage plans and understand the pros and cons according to our clients, watch this video next.